Hi and hello everyone. In this video, we'll be discussing serotonin pharmacology. So another autocoid, serotonin, and along with that, we'll discuss the drugs for migraine. We'll discuss what are the drugs for acute attack of migraine and also prophylaxis of migraine. So let us start the serotonin pharmacology. Let me write the name serotonin. Serotonin. It is also written as 5-HT. 5-hydroxytryptamine is another name of serotonin. Now this acts on the receptor called serotonin receptor. So the receptors are between 5-HT1 to 5-HT7. There are 7 subtypes of receptor. But importantly, we should remember the 1 to 4 receptors. 1 to 4 receptors are very important. Almost all the receptors are G protein coupled receptor except one, and that is 5-HT3. 5-HT3 is an ion channel receptor, and we have discussed that in general pharmacology. One more common thing you have to understand, the drugs available for 5-HT1, the drugs available for 5-HT4, usually they are agonist. And the drugs available for 5-HT2 and 5-HT3, usually they are antagonist. So these are the general points I just want to tell you before starting serotonin properly. Now in serotonin pharmacology, let us start with the receptor 5-HT1. Now 5-HT1A partial agonist, the name of the drug is called buspirone. Now where do I use buspirone? The major use of buspirone is the general anxiety disorder, or it is used in the chronic anxiety conditions. So it is used in the anxiety condition, that is general anxiety disorder and chronic anxiety. The next question is, will this buspirone act or work in acute anxiety? No, it takes time to work. The reason is this is a synapse. This is a synapse, and 5-HT1A receptors are present here. So these receptors are stimulated by the drug buspirone, and remember they are partial agonist of 5-HT1A receptor. So by stimulating that, they decrease the serotonin release, and if you decrease the serotonin release, there is decrease in anxiety. So this is the mechanism how buspirone decrease the anxiety by reducing the release of serotonin, and it takes time. So that's why they are not useful in acute anxiety. Many a times we confuse this drug with bupropion. Now bupropion we study in antidepressant drug. It is called as NDRI, noradrenaline dopamine reuptake inhibitor, and it is mainly used in depression, smoking cessation therapies. How do I avoid the confusion? Remember bus will do the bus sound, snake. So what happens when I see the snake? Anxiety. So buspirone is used for chronic anxiety. So that is about 5-HT1A drugs. Now we have 5-HT1B 1D agonist. 5-HT1B 1D agonist, the names are called as triptans. Now triptans, they mainly cause vasoconstriction, and they decrease the nausea and vomiting, and not only that, they decrease neurogenic inflammation. Now which condition we require vasoconstriction, decrease in nausea and vomiting, and decrease in neurogenic inflammation? We require that in migraine. And which migraine I am talking about? The acute attack of migraine. So for acute attack of migraine, the drug of choice are triptans. They end with triptans like sumatriptan. They end with triptan. In one of the exam, they had asked the mechanism. They are 5-HT1B 1D agonist. Now, there are two theories what we have in migraine. The vascular theory, which will tell there is extracranial vasodilation, so this causes vasoconstriction, point number one. And migraine patient, they develop nausea and vomiting, it decreases. And the trigeminal nerve can get inflamed, and there is increase in CGRP levels, that is calcitonin gene related peptide, that is also reduced by the triptan drugs. So that is the reason why these are the drug of choice for acute attack of migraine. So that is about triptans. Now, since they cause vasoconstriction, they should not be used if a patient is having ischemic heart disease or if the BP is not controlled. So uncontrolled hypertension, ischemic heart disease, these drugs should be avoided because of the vasoconstriction property. Once I know the triptans, the name is triptans. Let us see what drugs we have. There are plenty of drugs. If you see the number 1, 2, 3, 4, 5, 6, 7 triptans. Should I remember all the triptans for the exam? Not required. Please understand they end with the name triptan. Sumatriptan, naratriptan, zolmitriptan, rizatriptan, frovatriptan, almotriptan, L-triptan. If you don't want to remember, at least remember the sumatriptan and the mechanism. Now, the rizatriptan, it is like a razor, works faster. So it has fast onset. Riza, it's like a race, it will work faster. Frova means forever. So the meaning is it acts longer. So this is longer acting triptan. Otherwise, just remember the names end with triptan, the mechanism of action where they are not used. The next thing we need to understand is the receptor, that is 5-HT3 and 5-HT2. So the next receptor we need to understand is the 5-HT3 and 5-HT2. I told you for both of them we have antagonist. So the 5-HT3 antagonist, what are they? The 5-HT3 antagonists, they end with cetron. Example, ondansetron, palonosetron, granisetron, dolosetron, they end with the name cetron. And they are used in managing vomiting, particularly they are the drug of choice for early chemotherapy induced nausea and vomiting. So this is tested plenty of times. Mark this. Now we have 5-HT2 antagonist, and they are called as atypical antipsychotics. They are called as atypical antipsychotics. Example I will give you, clozapine and a drug called olanzapine. They mainly block the receptor 5-HT2 and they are used in treating psychotic problems. So we are done with 5-HT1, 5-HT2, 5-HT3, and what is left out is 5-HT4. We have a drug called cisapride, mozapride, tegaserd. So when the cisapride came, we took the pride of this drug, but why did we took the pride? Because it was used as prokinetic drug. Even mozapride is used as prokinetic drug. And you know where we use prokinetic drug? We use prokinetic drug in the management of GERD. So cisapride and mozapride are used for GERD, but cisapride has been banned recently. The reason for banning cisapride is it causes QT prolongation. And that QT prolongation can lead to arrhythmias and death in the patient. And that's why cisapride, the pride what we had, has been removed. So we have only one pride, that is mozapride, which is still used. Now tegaserd, it's also 5-HT4 agonist. It was used for constipation, but the drug was banned. The reason for banning is the patient had increased risk of MI, increased risk of stroke. The drugs are banned. The name is called tagacert. Now that is what you need to remember in serotonin pharmacology. What are the drugs for 5-HT1, 5-HT2, 5-HT3 and 5-HT4. And now we will come to the drugs for migraine. Now typically where do you see migraine? You see in a female population. The headache is typically the hemicranial headache, that is one-sided headache, and patient will develop the nausea and vomiting symptoms, photophobia, and they may develop aura symptoms also. So these are typical to tell it's a migraine. Now I told you there are two theories to tell migraine: the vascular theory, where there is extracranial vasodilation, and second theory is the neurogenic inflammation of trigeminal nerve increasing CGRP and the headache increases. So whenever I manage migraine, I have two important strategies to manage an attack of migraine for acute attack and the drugs used for prophylaxis. So whenever somebody had an attack of migraine immediately, then I have to treat. What is prophylaxis? I don't want the patient to get the attack of migraine again and again, because migraine headache is one of the incapacitating headache. Patient has to stay indoors in the home. He cannot talk to anyone. He cannot do the work. So it is better to take prophylaxis and then live the life. That means improve the quality of life. So whenever somebody have the attack, the first thing what we start is obviously the NSAIDs we start. If it is a mild case, and also we start certain anti-emetic drugs. But if it is not controlled with this, the migraine is increasing more and more, then the drug of choice become triptans. So triptans are the drug of choice for acute attack of migraine. The other options what we have for attack of migraine are ergots, and also we recently found out drugs which can block CGRP, and also a drug which is a 5-HT1F agonist. So these are the drugs for acute attack of migraine. We will understand them. Let me repeat again: NSAIDs, antiemetics, triptans, ergots, CGRP antagonist and 5-HT1F agonist. All other drugs we will be discussing. They are for prophylaxis. I will give a mnemonic: 2 ABC drugs. So let us see what are the 2 ABC drugs used in prophylaxis of migraine later. First of all, let us see the acute attack of migraine. So whenever there is acute attack of migraine, what we start is NSAID. For example, we can give the drug called diclofenac, ketorolac. So these are going to take care of the pain. The next thing what we have to do is we have to use certain antiemetics. So what antiemetics are given? Number one, we can give metoclopramide, or we can give ondansetron for stopping the nausea and vomiting feeling. Then the drug of choice are triptans. So sumatriptan is the drug of choice. Sumatriptan is the drug of choice, and it can relieve the headache faster. Is there any other option? Yes, we have ergots also. So 2 ergots are used: ergotamine and dihydroergotamine. Remember, these are ergots, and you know one of the adverse effects of ergot is vasoconstriction and gangrene. So they can cause vasoconstriction. So what is the problem in migraine headache? Vasodilation, they cause vasoconstriction. The question is whether should I give triptans or ergot? Which one is better for acute attack of migraine? And why triptans are the drug of choice? Because ergots will not reduce. They will not reduce the nausea and vomiting. They will not decrease the CGRP activity. So because of this, the better ones are triptans. Since these are also vasoconstrictor, I cannot use if the person is having the ischemic heart disease, where the vessels are having vasoconstriction or vasospasm, or I cannot use if the person is having uncontrolled hypertension. I cannot use these drugs. So in cardiovascular diseases, ergots and triptans cannot be used. We should be very careful. So that is the story of ergots. So one of the question asked in one of the FMGE exams was, patient came with migraine. A drug was given. Patient developed the decreased sensation, numbness, tingling, and what was the drug used and how do you reverse it? So the drug used is ergot. So ergots cause vasoconstriction, so the blood flow decreases. Patient will develop that strain sensation. And how do I reverse it? By using vasodilator. And the vasodilator that is used is sodium nitroprusside. Now why sodium nitroprusside is used? It can dilate the vein and artery equally. It can dilate the vein and artery equally. Now the next question they will ask you is, suppose a person has already taken sumatriptan for attack of migraine. Can I give ergots also if the migraine is not controlled? So I have given sumatriptan, sir, but the migraine attack is not coming down. Can I give ergot? No, because both are vasoconstrictors and the BP may rise. Then if I want to give, what is the time gap, sir? The time gap should be 24 hours gap. So if the triptans are given, don't give ergot up to 24 hours. If you are giving them, there is a dangerous vasoconstriction, BP may shoot up. That's the reason. The next thing is antiemetic. I think I have discussed, you can give ondansetron or you can use metoclopramide. Now the recent drugs, the new drugs for acute attack of migraine are CGRP antagonist. I told you CGRP stands for calcitonin gene related peptide. Now this is responsible for migraine, so we can block it. The name is, they end with G Pant. G Pant. You know a cricket player called Rishabh Pant? Yes, Rishabh Pant comes in emergency whenever the India batting collapses, headache comes. Then the Pant will comes to the rescue. So similarly, we have the G Pant drugs which are used in attack of migraine. So attack of migraine, we can use this G Pants. There are two G Pants, Ubrogepant, Rimegepant. If you don't want to remember the names fully, remember the end with G Pant. Because we also have CGRP antagonists which are used for prophylaxis of migraine. So attack of migraine, we use G Pant drugs. Then I told you there is a 5-HT1F agonist. The name of the drug, see the name, lasmiditan. Lasmiditan. What is the specialty of this? This mainly decreases CGRP and it decreases nausea and vomiting. But one advantage of this drug is it will not cause vasoconstriction. That means you can use it in a patient with ischemic heart disease or uncontrolled hypertension. So anybody having cardiovascular risk and they are having acute attack of migraine, so the recently approved drug is lasmiditan because it will not cause vasoconstriction. The name is lasmiditan. Okay, sir. Now once I understand the drugs for acute attack of migraine, it's the time for prophylaxis. I don't want the patient to develop the migraine again and again. The mnemonic is 2ABC. T stands for the tricyclic antidepressant. The name is called amitriptyline. O stands for a toxin called onabotulinum toxin A, and we have discussed that when we discussed the botulinum toxin in the ANS pharma. A, they are nothing but anti-epileptic drugs. Remember the mnemonic GST drugs. What are GST? You know what is GST, but this is gabapentin and S stands for sodium valproate and T stands for topiramate. So these drugs are used for prophylaxis of migraine. Then what is the B for beta blocker? The commonly used beta blocker is propranolol. Remember, If they ask in the exam what is the most common drug used for prophylaxis of migraine, it is propranolol. Then C stands for CCBs. We have two CCBs, verapamil and flunarizine. Verapamil blocks L type of calcium channels. Flunarizine inhibits T type of calcium channel, and they are used for prophylaxis of migraine. Another C for candesartan. Candesartan is a ARB, but it is also been used in prophylaxis of migraine. Then CGRP antagonist, I told you, in emergency, that is in attack also we use this, but in prophylaxis also we use it. And remember, the drugs used in prophylaxis, they end with MABs. They are monoclonal antibody. The name is erenumab, galcanezumab and fremanezumab. Sir, how do I remember these drugs? I will give you one story for this. Erenumab, you remember as every girl can. So every girl can free a man from what? Headache. If a girl goes out, a man can be free from headache also. So remember like that, it's just for a joke. Okay. So erenumab, every girl can free a man. Let us repeat the name: erenumab, galcanezumab and fremanezumab. So even if you don't know the full name, at least you remember the buzzwords, that is enough. Erenumab, a girl can free a man, fremanezumab. So these are the CGRP antagonists. Remember, these are used for prophylaxis, not for attack. Okay, sir. Now, once we have done the serotonin and the migraine drugs, let us do some high yielding points and let us clarify certain things here. Buspirone is used in where? It is used in general anxiety disorder, and also it is used in chronic anxiety. But don't confuse with the drug bupropion, which is NDRI, and it is used in depression and smoking cessation. It is used in smoking cessation. So I told you, bus, think of the snake. When you see the snake, anxiety. Sumatriptan acts by which agonism? Remember, triptans are 5-1B, 1D agonist. Lasmiditan, it's also serotonin. It is 5-1F agonist. Erenumab, I told you, every girl. So used in acute attack of migraine. Is it true or false? Remember, MABs in migraine are not for attack. They are for prophylaxis. So this is a false statement. Ubrogepant, G-Pant, Rishabh Pant. It's a CGRP antagonist used in acute attack of migraine. True or false? True. So any G-Pants, they block CGRP and they are used in attack of migraine. Ergot-induced vasospasm can be reversed by sodium nitroprusside. True. The reason is sodium nitroprusside is an equal dilator of artery and vein. Ergotamine and sumatriptan can be given together to control acute attack of migraine. True or false? False, because both are vasoconstrictors. The BP may go up, there may be a stroke. So if you want to give them, you should give a gap of 24 hours. Triptans are used as first-line agents for treatment of acute severe attack of migraine. Yes, true. They are the drug of choice for acute attack of migraine. Triptan should be used carefully in patients with cardiovascular disease. True, because they are vasoconstrictors. They can worsen ischemic heart disease, uncontrolled hypertension. Triptan should be carefully used in patients with antidepressant drugs. Now remember, antidepressant drugs, most of them increase serotonin. And triptan's action is to stimulate the serotonin receptor 1B, 1D. So what happens if serotonin is high and you are also stimulating serotonin? This will lead to serotonin syndrome. So that is the reason you should be careful when you are using in a patient with antidepressant. There is a risk of serotonin syndrome. Okay. Combination of ergot and caffeine is used for treatment of migraine. So if you have given treatment for migraine patient, you can see in the tablet, ergot and caffeine are given together. Why are we adding caffeine? The caffeine increase the absorption of ergots. Caffeine increase the absorption of ergot, that is why it has been added. This is a true statement. Let us solve some MCQs here. Which of the following is a drug for prophylaxis of migraine? Fludarabine, it's an anti-cancer drug. Just to confuse you, it has been given. Fomepizole, it's an antidote for ethylene glycol and methanol poisoning. Flumazenil is an antidote for benzodiazepine overdose. The drug for prophylaxis is flunarizine. It blocks T-type calcium channels. The next question is CGRP receptor antagonist for prophylaxis of migraine. I told you for prophylaxis CGRP blockers, they end with MAB. Search the drug. So there is only one drug ending with MAB. The name is erenumab. GPANT also blocks CGRP, but they are used for acute attacks of migraine. This one also. Lasmiditan is a 5-HT1F agonist that is also used in acute attack of migraine. But here, as per the question, erenumab is the answer. Now moving on to the next question, which drug is not used for prophylaxis of migraine? Topiramate is used, valproate is used, gabapentin is used. Lamotrigine is not used in prophylaxis of migraine. I told you the mnemonic, the anti-epileptic drug GST. G for gabapentin, S for sodium valproate, T for topiramate. Which drug is not used for prophylaxis of migraine? I think the same question has been repeated. So with that, we have come to the end of this topic, serotonin and drugs for migraine. So please understand triptans, ergots, and what are the drugs for migraine attack and what are the drugs for prophylaxis. So initial drug what used for acute attack of migraine is NSAID. Drug of choice for acute attack of migraine is triptans. Most common drug used for prophylaxis of migraine is propranolol. And triptans act by 5-HT1B, 1D agonism. And triptans and ergot should be given with a gap of 24 hours. And lasmiditan is a 5-HT1F agonist and it will not cause vasoconstriction. So you can give easily in cardiovascular disease patients. And you can block CGRP. If you are a GPANT drug, then for attack. If you are a MAB, then it is for prophylaxis. So happy learning. Thank you all. Take care.